So first, I would check the medical record to be sure that my patient has an order for a urinary catheterization, which they do. And now I will gather my supplies and head into the patient's room. Performing hygiene. Hi, my name is Jordan and I'm going to be your nurse today. Can you verify your name and date of birth for me, please?
Cindy Jones, October 27th, 1973.
Great, everything matches. And do you have any allergies, specifically to latex or iodine?
No.
No? Okay, and are you in any pain right now?
No.
No? Okay. So I am just going to be inserting a Foley catheter today, and that will just ease your urinary retention and empty your bladder. All right, so I will get started. So I have my catheterization kit, and I first want to check the expiration date, make sure it is not expired, which it isn't, and I'm also going to make sure that it hasn't been opened, which it hasn't, so I'm all set. And I have made sure that my patient is in a comfortable working height for me and a comfortable position for themselves, the correct position to perform this catheterization. So this is just trash, and this I will use to date and initial the catheterization once it's inserted. So I can put that aside, and this is my first sterile field. So here's just my sterile gloves, so I'll put those aside for when I'm going to put those on. And here is the first drape. So this drape goes underneath the patient, and normally I would be able to ask the patient to lift their butt up, but in this case I can't, and I'm going to put the shiny side down. So I'm just going to lift a little bit. And now I will take the second drape and I will place it over the patient, being sure that the meatus is open right in the center. Okay, and now that is set up, and I will put on my sterile gloves. First, I'm going to put on my dominant hand. And now my non-dominant hand. Okay, and I am sterile. So I'm going to keep them above my waist into the sterile field. So now I'm just going to get rid of the things that I won't be using. So I only need one pack of the swab sticks. I won't be using this. I don't need a sample. And yes, so I will be using everything else. So first I'm going to remove the swabs, put them on a tray, and I will take the lube and just put them right on the tray. go. And then I'm just going to just roll it up there. And next thing I'm going to do is I'm going to take the catheter itself and remove the plastic. And I can hold the catheter 2 to 3 inches from the top, and I'm going to just dip it into the lubricant 1 to 2 inches and get the top. There we go. And now I'm going to take the syringe and put it on my balloon port, but I won't be blowing up the balloon until the catheter is placed inside the patient. Okay, so now I'm able to put this back here so that I can move my sterile kit. To the patient. Okay, so my first step will be I will clean the meatus from using 1 swab per side. So I'm going to stabilize the 2 labias with my non-dominant hand, and I'm going to use my dominant hand to wipe. So this is going to be on the right side, and that one is done. And then this one is the left side, and that one is done. And then here's the last one. It goes right down the center over the meatus, and that one is done. So now I'm all set with this, and I will be inserting. This is already has lubricant on it, so I do not need to put it in there again. And I will ask the patient to bear down while I insert the catheter. So I'm going to hold it 2 to 3 inches from the top, and I'm going to have the patient take a few deep breaths and bear down, and I'm going to insert it until I get urine return. And then once I get urine return, I will advance it 2 to 3 more inches. And there we go. And so I will stabilize the catheter with my non-dominant hand, and I will take my dominant hand and I will insert 5 milliliters of the solution into the catheter so that the balloon will blow up. Okay, and that is 5. So now I will check for resistance to be sure that it is in place properly. I tug back, and yes, I'm feeling resistance, so that's good, and we know that it is in place. And now I can just take my syringe and put it off to the side. And normally I would throw my syringe in the sharps container, but in this scenario I do not have one. And now I'm going to just remove the drapes. I'll take that out of the way. And then I want to remove the drapes by just ripping it from the top. There we go. And the drapes go right into the trash. And now I am able to remove my gloves. And I will perform hand hygiene. And now I will be sure to stabilize the catheter itself to the patient's thigh. Usually it can be done with an elastic or something along those lines, but obviously I won't be able to stabilize it in this scenario. But so it would be stabilized to the patient's leg, and then it would be hung. And that didn't fall out. That's okay. And then it would be hung underneath, up below the patient's waist, usually on like the, it can be on part of the wheelchair or the chair or the bed or anything that's underneath the patient's waist. And I would label the bag itself with my initials, the date and the time, and I would perform hand hygiene, make sure the patient is comfortable, bed is locked, wheels are locked, and then I would leave the room, document the procedure, how the patient tolerated it, and yeah, and that's it.